Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Fareha, and today we are going to discuss heart sounds, ECG, cardiac output, and stroke volume. Okay, so first of all, we will go through ECG. What is ECG? ECG is basically electrocardiogram, and ECG is the electrical activity in the heart which can be detected by attaching electrodes to the limbs and chest. The pattern of the electrical activity, it may be displayed on the oscilloscope screen, which is shown. Apparatus which is used is called as electrocardiograph, and the tracing is called as ECG. You can see on this picture that there is a figure being shown, and in this there is firstly a P wave. Now the P wave, it arises when the impulse from the SA node sweeps over the atria. That is atrial depolarization. Always remember that when the word depolarization comes, it means that there is certain contractions occurring there. Like in case of atrial depolarization, atria will be contracted. After the P wave comes the QRS complex. QRS complex represents rapid spread of impulse from the AV node through the AV bundle towards the Purkinje fiber downwards and the electrical activity of the ventricular muscles. That is, ventricular depolarization occurs. Now we have already discussed that ventricular depolarization means that ventricles would contract. Alright, next is the T wave. But before that, we should note that there is a delay between the completion of P wave and the onset of QRS complex. It means that there is certain gap between P wave and QRS complex. The reason being is that the conduction of impulse through the AV node is much more slower than the conduction elsewhere in the heart. That is why there is certain gap between P wave and onset of QRS complex. Now comes the T wave. T wave represents the relaxation of ventricular muscles, that is ventricular repolarization, and repolarization means relaxation. Atrial repolarization occurs during ventricular contraction. Okay, now remember that the ECG originates from the SA node and is known as sinus rhythm. The rate of the sinus rhythm is approximately 60 to 100 beats per minute. A fast heart rate is called as tachycardia, and a slower heart rate is called as bradycardia. It could be physiological, it could be pathological, which we will discuss later on. Our next topic is heart sounds. We as individuals, we are not conscious of our heartbeat. But if a stethoscope is placed on the chest wall a little below the left nipple and slightly near the midline, heartbeat is heard quite. There are 4 heart sounds corresponding to a particular event in the cardiac cycle. If you can recall your previous lectures, you will remember that the cardiac cycle consists of different phases. First is the atrial systole, which means the atrial contraction. Second is the ventricular systole, which is the ventricular contraction. And the third phase is complete cardiac diastole. That means that the whole of the heart is relaxed, which occurs while the heart is filled with blood. So, at different cardiac cycles, different heart sounds are heard. There are 4 different heart sounds: first, second, third, and fourth. But only first 2 are important for you guys. The first heart sound is called as lub. It is fairly loud and due to the closure of AV valve. It corresponds with the start of the ventricular systole. Second heart sound is called as dub. It is softer. It is due to closure of aortic and pulmonary valve. It corresponds with the ventricular diastole. Alright, so there are 2 heart sounds which are important for you people. The first heart sound is S1, which is lub. The second heart sound is S2, which is dub. The first heart sound is due to closure of AV valve during the ventricular systole, and second heart sound is due to the closure of semilunar valve, which are aortic and pulmonary valves, during the ventricular diastole or during ventricular relaxation. So we have covered our two very important topics. First one is ECG, second is heart sounds. I want to give you people a little assignment. You have to draw this ECG on your paper. Just draw it and do some exercise, how a P wave is drawn, how the QRS complex is drawn, and how the T wave is drawn. In this way, you will remember the different activities occurring at these different waves. Okay, so our next topic is cardiac output. Cardiac output is the volume of blood which is pumped by heart per minute, and it is denoted by milliliter per minute. So we can generate our own formula considering that it is volume of blood pumped by the heart per minute. So heart rate into stroke volume would give you the cardiac output. I will discuss further that what is stroke volume. Stroke volume is the blood which is pumped by heart in every heartbeat. And heart rate, as the name indicates, it is the heartbeats per minute. Cardiac output, normal values, we will discuss that the stroke volume is 70 milliliter, heart rate normal value is 72 per minute, cardiac output is 5 liters per minute. Cardiac output can be greatly increased in exercise to around 25 liters per minute and in athletes to 35 liters per minute, just to compensate the increased amount of blood which is being filled into the heart, and it is later on pumped by the heart throughout the body by the increase in cardiac output. But there is certain limit to which cardiac output can be increased, and we will discuss this just after a few slides. Okay, so when the increased blood supply is needed to meet the increased tissue requirements of oxygen and nutrition, heart rate and stroke volume increases. And this increase during exercise is called as cardiac reserve. Okay, so let me discuss stroke volume further. Stroke volume is determined by the volume of blood in the ventricles immediately before they contract. That is ventricular end diastolic volume, which is also called as VEDV, also called as preload. Preload mainly depends on the amount of blood which is returning to the heart through superior and inferior vena cava. Increased preload or stronger contraction as more blood has to be pumped out, and thus stroke volume and cardiac output increases. Okay, so basically, what is preload? Preload is all the amount of that blood which is returning to the heart with the help of all our veins, superior and inferior vena cava. Now, if the preload is more, if the preload is increased due to certain condition, then it means that the heart has to pump all of this blood with increased heart rate and increased cardiac output. Okay, so when the increased preload is over there, the stronger contractions would be there as more blood is there, and stroke volume and cardiac output also increases. I hope this concept is clear with you guys. Heart, within the physiological limits, pumps out all the blood by adjusting cardiac output and stroke volume. This we have already discussed. But this capacity to increase stroke volume is finite. It is not infinite, it is finite. And when the limit is reached, that is, venous return to the heart is greater than the cardiac output, that is, more blood is arriving in the atria than the ventricles are pumping it out. What happens is that the cardiac output now decreases and the heart begins to fail. I will repeat this concept again, that if there is increased preload, that means that more blood is coming into the heart through the superior and inferior vena cava, the cardiac output would increase after that, and stroke volume would also increase. But if it keeps on increasing, the preload keeps on increasing, then there is a certain limit to which cardiac output can be increased. After that, heart begins to fail and cardiac output decreases. Okay, so heart rate we have already discussed. You should remember these definitions for your MCQ point of view. that heart rate is the heartbeats per minute, stroke volume is the blood pumped by heart in every heartbeat, and end diastolic volume is also called as preload. It is the volume of blood in the ventricles before the contraction. Venous return is the amount of blood returning to the heart through superior and inferior vena cava. So the preload means the blood coming into the heart, and afterload means blood exiting the heart. The factors which affect the cardiac output. So, autonomic innervations, hormones, electrolytes, position of the body, exercise, emotional states, gender, age, temperature, baroreceptor reflexes, all these factors are affecting the cardiac output. The contractility of the heart is also under the influence of autonomic innervation and the hormones. Okay, so factors which increase the myocardial contractions are increased sympathetic nerve supply to the heart and certain hormones like adrenaline, epinephrine, norepinephrine, thyroxine. All of these may cause increased myocardial contraction. So this covers up our today's lecture. It was quite a simple lecture. I would just like to go through different things. We have discussed heart sound number 1, 2, and ECG. You have to draw the ECG diagram in your copies. And then we discussed cardiac output, all right, which we discussed that it is heart rate into stroke volume. Then we discussed the stroke volume and the factors which increases the myocardial contraction. That is all for today. Thank you so much. Allah Hafiz.